The average 8 to 18-year-old in the US watches 4.5 hours of TV every day. 7 out of 10 youth have a TV in their bedroom. Parents worry over the amount of TV their children are watching for many reasons. TV receives much of the blame for the steep increase in childhood obesity. Pediatricians recommend that children watch 2 or few hours of TV per day, and that TVs are not allowed in children's bedrooms. Yet these recommendations are not being followed. Studies have shown an association between TV viewing and obesity, but we do not know how TV use relates to children's body fat or their risk for cardiovascular and metabolic problems. Our research team at Penninton Biomedical Research Center in Baton Rouge, Louisiana, set out to examine how TV use is associated with children's body fat and cardiometabolic risk. First author, Dr. Amanda Staiano, shares the methods and results of this exciting study.
From January 2010 to August 2011, 423 children between the ages of 5 and 18 participated in our study. These children came to Penninton Biomedical for a 3-hour visit. Our clinical staff measured children using traditional anthropometry. These medical professionals assessed children's weight and height using standardized procedures, and we calculated their body mass index percentile based on the CDC growth charts. Next, we measured the waist circumference as a key indicator of cardiovascular risk. Our clinical staff measured children's risk factors for cardiovascular disease. We measured their resting blood pressure, and we took a fasting blood draw to measure their cholesterol, triglycerides, glucose, and insulin levels. To find out about their TV use, we asked children to fill out a lifestyle questionnaire. The younger children were helped by their parents. In the questionnaire, children reported how many hours per day they typically watch TV, and they reported whether or not they had a TV in their bedroom. We also collected information on their typical physical activity, their dietary pattern, and demographic information to use as covariates in the analysis. We were also interested in the children's body fat, and specifically where their fat was stored on their bodies. We used a whole-body DEXA scanner to measure their total body fat. This is an example of a DEXA scan with the fat mass indicated. We used MRI of the abdomen to measure the specific depots where adipose tissue was stored. We assessed 5 to 7 cross-sectional images of the abdomen, from the top of the liver to the bottom of the kidney. Scans were then analyzed to quantify total fat in specific depots of the body. Using validated and reliable procedures, our technician identified subcutaneous fat, which is the fat that lies just below the skin, and visceral fat, which is the fat under the abdominal muscle that surrounds the organs. Visceral fat is particularly associated with cardiometabolic health risk. For our analysis, we used the 2011 NHLBI guidelines to determine which children met criteria for cardiometabolic risk. We found that 2/3 of the children in our sample had a TV in their bedroom, and 2/3 of the children watched more than 2 hours of TV per day. Children who had a TV in their bedroom were more likely to watch more hours of TV per day. Children who watched more than 2 hours of TV per day had 2 to 3 times greater odds of having high body fat, high subcutaneous fat, and high waist circumference, even controlling for age, gender, ethnicity, diet, and physical activity. Children who watched more than 5 hours of TV per day were more likely to have high levels of visceral fat. Having a TV in the bedroom was associated with 3 times the odds of having elevated cardiometabolic risk, including high waist circumference and high triglycerides.
TV watching habits were indeed related to measures of obesity and health risk in our paediatric sample. These results remain significant, even controlling for physical activity and diet. It is interesting that having a TV in the bedroom had a stronger association with the health outcomes compared to TV viewing time. One explanation is that having a TV in the bedroom may disrupt healthy habits. For instance, eating meals together as a family can be protective against developing obesity. Having a TV in the bedroom may be a distraction away from having family meals. Also, watching TV late at night may disrupt sleep, another protective factor against obesity. Children use other forms of media, like video games and computer games, which are still mostly sedentary in nature. TV viewing is expanding beyond the traditional TV screen to other media platforms, like laptops, cell phones, and iPads. This suggests an even more pervasive effect of media use on children's lives beyond the TV screen. The take-home message of this study is that watching more than 2 hours of TV per day and having a TV in the bedroom are associated with high body fat and with risk for cardiometabolic problems in both children and adolescents. TV has a significant negative association with children's health. It is important that families promote active lifestyles and healthy eating to prevent childhood obesity and to help our children live healthy lives. We greatly appreciate the funding organisations and the valuable team members who contributed to this project.